Good morning and welcome to today's episode of a serious problem in women's health called Polycystic Ovary Syndrome. As a woman, are you afraid or have fear regarding frequent, infrequent, prolonged, or heavy bleeding, accompanied by that horrible, embarrassing acne or even thinning of hair? Are you worried about swings in your weight, maybe gaining and losing, which is beyond your control and efforts? You are not alone. 1 in 5 people suffer from this syndrome, which is called polycystic ovary syndrome. Unfortunately, 70% of us go undiagnosed, and we continue to fear infertility, long term disease issues like cancer, heart, or anything that is dangerous to us. Maybe if we address it, we can control and protect ourselves. Let's discuss our doubts and fears with Dr. Urvi Sanyal, with Ms. Devdatta, posing our questions as patients. Thank you, Doctor, and welcome to everybody.
So, uh, today's topic is we are going to discuss on the PCOS and PCOD. And the tagline is itself says that PCOS is a threat of womanhood. So, as we all know that every year, many young women are getting affected by PCOS and PCOD. So, it's I request our Madam Gynecologist, Dr. Urmi Sanyal, who is having a vast experience in this field, to share her experience in this subject. And with a brief note of ma'am, I would like to introduce her that she is currently associated with the Mission Hospital, Durgapur, as a gynecologist. And she is MRCOG from UK and also DNB. And she is having her expertise in handling high-risk pregnancies and minimal invasive surgery and EMS also. So, ma'am, I welcome you. Today is the first session of this recording, and this is the first episode we are going to have for the patient initiative mainly. And our motto is to for the mass education awareness on PCOS and PCOD. I welcome you, ma'am, to give us a brief orientation about this subject.
Thank you, Devdatta, for the introduction. Thank you, Kaho, Patient for Patient Safety Foundation and Mission Hospital Durgapur for selecting this very important topic. As Devdatta said, PCOS is a thief on womanhood. Actually, it has profound effect on the life of a woman, starting from adolescence, and it even extends after menopause. It is a multifaceted disorder which has its effect on menstruation, metabolism, fertility, and most importantly, on the quality of a life of a woman. It was actually discovered as long back as in the year 1935, and it was reported in an American journal by the experts Steen and Leventhal. And from then onwards, we are expanding our knowledge on this topic on PCOS, and the incidence of the disease is also increasing. Now we know it is one of the most common endocrine disorder among women of the reproductive age group. It is one of the leading cause of infertility among young women. It has profound effect on metabolism. Most importantly, for PCOS are the long-term effects. It is well established that there is an association between PCOS and cardiometabolic health. It is being established that it predisposes to heart diseases, hypertension, diabetes, renal dysfunction, mental health problems, sleep disorders, and most importantly, even it may cause cancer of the womb. So these long-term consequences are also a very important part of the spectrum of PCOS. So it is not only a problem for the gynecologist. It should be managed by a team of multidisciplinary experts like cardiologists, hepatologists, psychologists, nutritionists, and etc. But the problem with PCOS is that, unfortunately, it has got no cure. We cannot cure PCOS. What we can do is to have a symptom-oriented treatment. Means we can reduce the symptoms and also make sure that the long-term consequences are in control. Another problem with PCOS is that it is being overdiagnosed sometimes. Many a times, a woman, even a small girl, runs to my OPD in a very panic mode. Why? Because of a incidental finding of multicystic ovaries. We need to know that naturally, if we do an ultrasonography, we will find the ovary cystic, because the natural cysts or follicles are made to produce eggs every month. We will call it a polycystic morphological ovary if it is having twice the number of follicles and the size are bigger. And along with it, we need to have a hormonal imbalance in the woman also. So no point in overdiagnosing and overtreating. At the same time, we should not underestimate also. Once we diagnose a woman having PCOS, we should have repeated counseling session, and we should also look at the long-term consequences. Because it is not only a question of 1-2 sittings, it's a question of following up the patients not only for the menstrual irregularities or the fertility part which they are focusing on, but the counseling of the long-term effects. I need to hammer this, that the long-term effects we should not forget, because it's not ending with periods and fertility. It is having an effect on the heart and the liver and your sleep, and most importantly, what we are addressing nowadays, the mental health. Mental health part and PCOS, they are very intimately associated. This is what is the main thing about PCOS. And next, we can just go ahead with what are the common questions the patients face when they come to the OPD.
Yeah. Thank you so much, ma'am, for beautifully starting the introduction and with a note, and for giving us the brief idea what is PCOS and PCOD means about and all. Now, as a layman, so I am a patient, I don't have much idea how it occurs, what are the symptoms, or what causes it. So from the common lot, if I ask you that what symptom, what are the first triggering point, if I say how to report it, or how this diagnosis, how to means.
Okay. So first I will talk about the cause. Unfortunately, the cause is yet not discovered, but what we have found that it is familial. Like if you have a mother or a sister or an aunt with PCOS, there is a very high chance that you will land up with PCOS also. There is a 20 to 40% chance, but probably it is gene associated, is a polygenic disorder, X-linked. And it has been found that 72% in twin studies, twins get affected that way. Coming to the presentation, mostly patients, they present with delayed menstruation or no menstruation at all. There is an increased propensity of hair growth in the body or in the face. There is loss of hair, in the head, and there is acne. And also there can be a multitude of other presentation. They can actually first time present to our OPDs with just a problem of infertility, because sometimes the period problems they don't bother with. The first time they present is with difficulty in conception.
Agreed, ma'am. Agreed. So, ma'am, often what we had observed is that means the diagnosis is commonly mistaken with the anemia, cancer, or fibroids or thyroid. So, how do you going to differentiate it that it's I am suffering from PCOS or PCOD? How are you going to differentiate it?
So there are very specific diagnostic criteria for PCOS. First, as I told you, the clinical presentation will be the menstrual irregularities and the symptoms of increased male hormones in our body, what we call the testosterone. Women actually produce little amount of male hormones, but in case of PCOS, there is increased amount of secretion of those male hormones that causes increased hair growth, baldness, and other acne. And in blood also, we will find increased levels of free testosterone. Okay. So one is in diagnostic criteria, one of them is menstrual irregularities. Second is clinical features of increased male hormones, or in the blood test, we will find them. And third is, as I told you, in ultrasonography, we may find increased number of follicles in both the ovaries, like we say 20 each and twice the volume. And A woman to be diagnosed with PCOS, we don't need to have all three of them.
Three of them.
So,
Any one symptom.
there is a criteria called modified Rotterdam's criteria that states that 2 out of 3 has to be there.
Then
So that's what I told that let's not overdiagnose by just a USG finding.
Got it.
But just a USG finding that does not stamp you as PCOS. And to rule out the other causes, we need to do a lot of hormone tests, including the thyroid hormones and other hormonal assays to rule out other diseases. So once a patient has to be diagnosed with PCOS, we have a clinical checkup that needs to be done. Along with that, blood test and ultrasonography confirmation.
So from there, we can easily get the clarity of the
Yes.
diagnosis.
And
how to
after
go
that, again, I will focus on once the patient is getting diagnosed with PCOS. Next, we have to see to the, as I said, the other systems. Okay. So first we have to check the liver function. We have to look at the diabetes part, especially in case of PCOS. We have two hormone imbalances. Okay. One is, as I said, testosterone, increased male hormones. Second is insulin. We have all heard about insulin. What? Yeah. So what insulin does, it is a natural hormone in our body. It controls the blood levels. In case of PCOS patients, what happens? That insulin sensitivity is lost. That means we need a lot more insulin in PCOS women to control their sugars. So what is happening? Insulin is not working, sugar levels are rising, and now the insulin is also rising to control that sugar. So that is what we find in PCOS women, and that increased insulin causes all the other effects also, even increases the male hormones. So all that we need to work out and do a cardiac checkup. We need to do a hepatic checkup, means the liver dysfunction,
that's
lipid
important.
profile, and very importantly, in case of women who are having delayed periods, sometimes there is a gap of 3, 4, 5, 6 months.
Many causes.
Yeah. So what we say that we need to bleed at least every 3 months. If we are not bleeding, then what happens in our womb, what we call the uterus, the lining becomes thickened. If we are continuously suffering from that and we are not curing it, like we are having a 3-4 months interval cycle for a long time, what happens? The thickening of the lining of the womb that increases, and later it may turn into cancer of the womb.
That's very
So
dangerous.
yeah, that is very dangerous. So that is actually very much preventable. So we need a regular follow-up of the patients and check the lining of the womb through ultrasonography. And if we find that it is increased, then there is also an endometrial workup that can be done to see whether any untoward changes have happened or not.
So, ma'am, what I can understand from your conversation is that there are initially, once we are getting diagnosed, we have to go phase by phase to rule it out.
Yes. And then take care of the long-term consequences. And
Correct.
that management is like a yearly or 1-3 yearly, BP you have to check yearly. Then sugar levels you have to check 1 to 3 years. So once negative does not mean you will be negative your entire life. You have to come back.
Correct.
Yeah.
They have to come.
Hmm.
So, ma'am, another dimension, if I want to discuss with you, that is the weight gain or is it genetic? What is the background of it? If I try to figure out, mostly cases, what you are handling, what is the background of this disease and what's the consequence it's leading to?
Yeah. So PCOS is associated with increased weight gain. So whatever hormonal imbalance is happening in PCOS, it is causing weight gain. Okay. So that weight gain is again in a vicious cycle causing a lot of other problems. But at the same time, we should not be thinking that since I have PCOS, there is difficulty in weight loss. It does not happen that way. Whatever have hormonal imbalance, like the increased androgen levels or the insulin resistance, all these cause a weight gain. Okay. And we can control that by lifestyle modification. But it is not that a woman who does not have a PCOS has an easier shot at losing weight than a woman who has PCOS. That is a misconception. At the same time, all PCOS women are not, overweight or obese. There are lean PCOS also, but for them also, working out and keeping a physical fitness in line.
That's important.
That is very important.
Ma'am, do all PCOS cases leads to infertility in the future, or are they going into that phase?
All cases do not lead to infertility.
Okay.
Okay. So what is the basic problem with PCOS is that every month the egg is not produced on the right time. Okay. So it is delayed.
That's the
We are
disorder.
having our periods only if we are producing egg. So once the ovulation occurs, within 14 days, we will bleed. So in PCOS, what is happening? We are not bleeding because it's not egg is not produced in the right time. That is where the infertility part comes, because the timing does not match. And at the same time, who is not ovulating at all? The egg is not produced, so the basic formation of human life is not happening. But the good part is that it is correctable. So we have a situation where the egg is not formed. So how do we treat it? We give medication for the egg to form. So it's very simple. So that's what we say, that if PCOS is a cause of infertility, it is very much treatable.
Very much
That is
treatable.
a
And that's
silver lining, if you may say.
so that may help the patients
Yes,
too.
yes, yes.
Yeah. Ma'am, another issue is that do there is a chance of miscarriage or ectopic pregnancy like high risk?
PCOS always makes the pregnancy high risk. At every trimester, there is some problem or the other. First of all, as I already told, that PCOS patients start off pregnancy either, not naturally. Sometimes you have to give medications and start off the pregnancy, or may go for artificial methods. That causes the pregnancy to be high risk. Even if in case of spontaneous pregnancies, PCOS patients are mostly overweight or obese, that causes a lot of impact on the pregnancy itself. And yes, PCOS do increase the chance of miscarriages, and also increase the chance of blood pressure, blood sugar in pregnancy, which are induced by pregnancy itself. And also there is a chance of preterm labor also in case of PCOS. So these are the side effects of patients who are having PCOS and going into pregnancy.
Ma'am, see, once a PCOS patient deliver a baby, so there is a chance of poor growth of the baby, like that, as you told that there is a high chance of having the preterm baby. So
There is a chance of poor growth. At the same time, if the mother lands up having a gestational diabetes, the babies are usually bigger than, larger than size. And that is again a vicious cycle,
Okay.
So there is a theory why the PCOS is increasing in incidence, because if we are having overweight babies, they are again predisposing to diabetes and all the other metabolic syndrome later in their life. And at the same time, it has been seen these babies, they survive because they have their internal mechanism working. So survival rate is more in PCOS babies, and they are ending up having again PCOS, and it is a cycle of life that is happening.
So future that these babies are healthy once they are.
As I told you, it is a familial thing. So 20 to 40%, if girl babies are, being born, they can again have PCOS and its repercussions.
Okay.
And also there is obesity among others also.
Got it, ma'am. Got you. So, ma'am, so this permanent will there any chance of permanent hormonal imbalance in this such type of patients? Will it carry on?
You see, as I told you, PCOS has no cure. So whatever hormonal imbalance is there will persist unless it is being treated. So we cannot treat the disease itself, but we can treat the symptom. We can, cure the hormonal imbalance by giving combined hormonal preparations and make the periods come monthly. So the situation will persist, but it can be under control. Why? By medication, and most importantly by lifestyle modification. As I tell my patients, the first, second, third, fourth, fifth, first 5 management of PCOS is lifestyle modification. Okay, so that involves first dietary modification. A balanced healthy diet is very, very important. Okay, the diet should focus on proteins more, less on the carbohydrate and fat part. Usually the diet advice is 30% reduction in the overall calories that we aim for. Okay, and less than 30% of that diet should contain fat, and saturated fats should be less than 10%. And also we usually advise to take vegetables and fruits more, and whole vegetables.
Oh.
Okay, so whole foods are very important, like whole grain cereals, whole wheat pastas, and the fiber part of the diet is very important. That is the diet part, and next is the exercise part. So exercise is very, very important. As I told you, obesity is a part and parcel of PCOS, and the main part of the obesity happens in the central part, what we call the central obesity. So fat in the tummy. So that needs to be that is very common, and that needs to be that needs to be reduced for the sake of the hormonal imbalance also, and for the long term consequences also. Okay, so how can we manage it? At least we have to do 30 minutes of exercise 3 times daily. That is the basic. You can do more than that, and it includes walking. You can do cardio, you can do stretching, you can do weightlifting and strengthening exercises, whatever be it, but activity is most important. But in case of lifestyle modification, we have this very nice acronym where we call it SMART goals. So the goals has to be, S stands for specific. Okay, so you need to know what you are aiming for. It is very specific. Okay, next is for SMART, M stands for measurable. We need to measure that. Today I'm 64, so I worked out, I became 60. So this is how we measure. So that measure
Target we are going
the
to
target has to be there. Okay, so next is achievable. Let's aim for something that we can achieve.
Achievable.
So in 2 weeks, let's not achieve to lose 10 kg.
Yeah, it's not possible.
That is
That's not
and that's where the next part of SMART comes, R, which is realistic. So it has to be achievable and realistic also.
Correct.
Like we both are professionals.
Yeah.
So in our daily life, we cannot imbibe a lot of activities the whole day.
No.
So we have to be realistic in perspective of what we are doing every day and imbibe the exercise accordingly. And next is timely. So make a time bound effort, but don't keep a deadline. That is
something
achievable.
in our daily life that we need to focus on.
Yes,
True.
that has to be chalked out. And also behavioral therapies are very important. What we say, like, PCOS patients have also been associated with eating disorders and all that. And so we need to set our goals and, reduce our stimulus, control on our eating habits and all that. So behavioral therapy forms a very important part of
For managing PCOS.
So what I tell my patients that it's not always about medication. Once you really have a good lifestyle going on, modifications are there. Even for 5% reduction in your weight may actually improve every aspect of your problem. The periods will be regular, your fertility will improve, your weight, your cardiac health will improve, your diabetes profile will not be that bad. So it's lifestyle modification.
That's the first and foremost thing what we try to achieve through lifestyle modification. It really helps not only for PCOS but for other kind of causes. For a good life, for a good quality of life, lifestyle modification and a healthy living.
Absolutely.
I also believe so.
And in PCOS, there is what we tend to ignore is the mental health issues. So once you start exercising, your self-esteem relaxation happens. It's also a therapy.
It acts as a therapy. I totally
it
agree.
does.
I totally agree with you, ma'am. Ma'am, just next, my question to you is that many patients are consuming this birth control pills. So what effect it has?
As I told you, that in case of PCOS, there are delayed periods, and too much of delayed periods, if the gap is more than 3 months, it's going to affect your womb in the long term and may cause cancer. So our aim is to bleed at least every 3 months. So what we can do, there are ways for that to happen. So either every 3 months you give a short course of medication, which is only progesterone, which is just a single hormone, and make the woman bleed. Or we can put her on combined pills that contains estrogen and progesterone, and also different function of those pills are birth control. The same combination helps in birth control, the same combination helps in regularizing the periods. So I offer my patients that what do you want? Like, if you want, you can just bleed every 3 months. If it's a regular thing for you not to bleed regularly, every 3 months, or you can put yourself on, combined pills. Now, many women nowadays are professionals, and this unpredictability in bleeding in case of PCOS makes life very difficult for them. The good thing about combined pills is that at least you can predict your bleeding. It helps, it makes life easier. At the same time, obviously, it has got medical values in regularizing your periods. So, and at the same time, married women, if they don't want a child, like added effect of birth control. And long-term effects of OC pills nowadays means the combined pills are not that bad. Those are very low dose.
Stigma,
There's a stigma that increases weight and all that. But actually, I tell my patients many a times, because they frequently ask me what is going to happen. Can I take the combined pills for a long term? You can take. Actually, it reduces a lot of cancer. Not only the uterine cancer that is predisposed by PCOS, it reduces ovarian cancer also. It reduces colonic cancers also. So a lot of good effects are also there. So we can very well go ahead with the combined pills.
That's a very much eye-opening concept. What you discussed, because
I get.
we usually carry a misconception
Yeah,
about
yeah,
this
yes, yes.
using such blood pills and all.
I also personally feel
Yeah.
unpredictability of bleeding in your professional life is very difficult.
Very difficult. Totally agree. Totally agree. Ma'am, any surgical intervention is there for this?
The surgical intervention comes under very specific, group. Like if somebody is really very obese, like BMI more than 30, we can talk about, fat reducing surgeries, bariatric surgeries that we call them. Another form of surgery can be thought about in case of patients who are suffering from infertility. So what we do is ovarian drilling. That is the second, third line of treatment. Since as I have already told you that in PCOS, what happens? Both the ovaries have a lot of extra follicles. So if we drill certain points, those follicles are reduced. At the same time, they say the male hormone producing points are also reduced. So overall, there is a good effect on the metabolism, also the hormonal imbalance also. So these are the two ways I think surgery comes into picture. Or as I said, if by ultrasonography, we are seeing that the womb lining is thickened. In that case, we can do a biopsy and check whether any cancerous changes are there, or precancerous or cancerous changes are there.
Okay, so that's another mode of detection, you can say.
Otherwise, surgical management in PCOS is not specific.
Not specific and not very regular also. Yeah, yeah. So, ma'am, so what are the general fears and doubts? If I ask you, so irregular periods you had told to us, and will it lead to permanent infertility in?
Permanent infertility does not happen. Like as I already told you that infertility happens because of delayed egg production.
Okay.
So that delay in egg production can be treated. So actually they have a lot of follicles. So eggs are more in a sense. So there is, a blood level that we frequently do, AMH, it is called. So that gives a count of how much reserve we have in our ovaries for the fertility part. In a PCOS patient, it actually comes more than normal. If it is towards the lower side, we say that ovarian failure and all that has happened, and it has got a bad effect on the fertility, long-term bad effect, if you say, on the fertility part. But in case of PCOS, it does not happen. It is very much treatable. Treatable, yes.
Yeah. Ma'am, once taking all the measures and everything, so is there any chance of reoccurrence once we have?
See, we talk about recurrence in something which we are treating for till the end. We talk about recurrence in cancer, suppose where cancer is cured. But PCOS cannot be cured. So the question of recurrence is not coming. It's a question of control. Whether your situation is in control, whether you are in good health, whether you are bleeding every month, exactly, your fertility is in place, all your other systems are working fine. So that way we can say that PCOS is controlled. But PCOS cannot be cured, so the question of recurrence does not come.
And ma'am, one modality is surgery, what I asked you, and anything related to herbal remedies or homeopathic treatment, any modality say comes in. If many
See,
patients want to opt for.
See, it's a patient's choice what they can go for. There are other forms of medicines that can be used to regularize your cycle. As I said, the most important is to regularize it. So they can go for it is helping, But if you ask me, what I advise my patients that don't mix the different forms of therapies. Medicines, if you are taking any one group, you should take. Taking multiple forms of medication does not help. Like you are taking allopathy, you are taking homeopathy, you are taking Ayurvedic at the same time, it does not help.
Yeah.
So the
Any
combination should be medication with exercise and diet control. So the medication the patient has to choose what the patient believes in.
beliefs. True.
So if you ask about herbals and all that, that should be more important in respect of lifestyle modification.
Agreed.
Uh,
So initially we need to control our lifestyle modification, which will help a lot and have a great impact.
yes,
To
most
control.
important impact
Most
on the
important.
pieces. Yes.
Got it, ma'am. So, ma'am, with this note, thank you so much for this is an eye-opening session for me. We came to know really unknown facts about the PCOS and PCOD. What are the factors involved in it? How we are going to mitigate it once we detected it in an early phase of life. So, ma'am, lastly, I would request you any take-home message for the young women, how they can able to manage themselves, how they're
Yes.
going to.
So my take-home message will be, a summary of what I have said already. Let's not overdiagnose and stamp yourself as a PCOS without coming to a professional.
It would be a stigma.
It should not be a stigma. Don't panic and don't call yourself PCOS all the time. Patients tend to do that. Women tend to do that based on a single fact. So PCOS is not a single problem. It's a combination of problem. It needs to be diagnosed. And at the same time, don't underestimate. Once you are actually diagnosed by a professional as PCOS, let's look at it as a long-term relationship with not only with your gynecologist, but also all the other medical professionals that can help you out. And most importantly, let's address the mental health problems that are associated with PCOS. Okay, so it does have an effect of mental health. So let's get to that.
Yes.
Hmm.
The mental health issues need to be addressed. That's a big part of it. I
Yes.
totally agree. So thank you so much, ma'am, for giving your time and helping us out. We try to reach out to the mass population and to address them, how to control this disorder or how to address the population so that they can like have a healthy and good lifestyle they can lead upon. And I would like to my sincere thanks to Kaho and Patient for Patient Safety Foundation for giving this platform. And I hope that near future we are going to do more sessions with you. We should encourage patient safety in this way. Thank you so much.
These doctor-patient conversations are brought to you by Kaho and Patients for Patient Safety Foundation. Kaho is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by Kaho, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.